want to send us a question, please do so. In the lower bar, you'll see a chat window that you'll be able, or a Q&A window that you'll be able to send us questions in. So please feel free to do that. The goal of today's meeting is to bring you information that will help you navigate through going back to work and reopening your company once restrictions are lifted on May 18th from a public health, safety, human resource, and legal perspective. We have a great lineup of experts today and a lot to get cover, so let's go ahead and get started. From a public health guidance and guidelines, Spring Schmidt is with us today. She is St. Louis County Health Department Interim Director, and she'll be discussing COVID reopening business guidelines in general and some specifics for St. Louis County businesses from a public health perspective for employer and employee and customer perspectives. Brian Hall hopefully will be joining us. He has had an emergency situation pop up to meet with the mayor of the city. So he may or may not be with us, but he sent us some information to share either way on some developing some industry specific guidelines. And then we also will hear from Human Resource, the Executive Director of Human Resources at the University of Missouri St. Louis, Jim Hurdle, who will be talking about reopening business best practices from a human resource perspective. Jumping in and tag teaming with him today will be Catherine Prulux, and she is with People Solution as a human resource consultant. Rick Dorsey is on the webinar today. He's an attorney at law and will be helping us with some legal implications for employers to employee and business to customer basics as we open our doors in this entirely new environment. So we're getting ready to have a whole new norm, if you will, and we know that you will have some questions. Again, please send those to us in the chat or the question and answer window, and we will try to help you through all of those. Now it is my pleasure to introduce Spring Schmidt and Brian Hall, if he ends up joining us. So Spring Schmidt is the acting co-director for St. Louis County Department of Public Health, along with the Chief Medical Officer, Dr. Emily Doucette. Her primary research interests are in community-based participatory research methods, health equity, and social determinants of health, and examining the school and community environments for factors that support and inhibit healthy decision-making and positive youth development. And then Brian, if he jumps on after Spring shares her presentation, is the Chief Marketing Officer for Explore St. Louis and a recognized expert in the field of travel, tourism, marketing, and advertising for more than 30 years. So let me go ahead and pass this webinar now to Spring.
Thank you, everyone, and I appreciate this opportunity to talk to you today. So I think you can see all of our the slides up here as we continue to move forward. And if you can advance one, we'll just do a brief introduction. If you have not seen the statistics for what we have been looking at in St. Louis County, we continue to see cases every day, sometimes between the 50 and 100 mark. It can be difficult as we continue to move forward through this. We have been on this kind of flattened aspect for a while where we've been plateaued right around this number, but still seeing new cases every day. These statistics are up on the stlcorona.com website. If you haven't seen that site, that is also where you will find the county executive's orders, public health orders, and then the guidance documents that have been created so far for broad general categories as well as specific types of businesses, many other things along that line. We're trying to keep that website as updated as possible with these statistics and several others, as well as all of the different guidance pieces and educational materials that we've been using. If you could advance to the next slide also. So I want to also frame this out a little bit in terms of why we continue to be concerned about where we are in St. Louis County. So these are some projections that were done by the state epidemiologist for the Missouri Department of Health and Senior Services in partnership with WashU and the Hospital Association and health departments around the state. many times when we look at a curve of a pandemic or other illnesses, you really want to see you really see it go through a curve. It goes through a big spike and falls down. That is not what we're seeing in the St. Louis region, and that is not what we are projected to see for a while. It looks like for the next month at least, we will be on this sort of long sloping plateaued trail. And we are just below what we call the rate of transmission of 1, which means that for the most part, when we find a COVID positive patient through our testing or one of our partners or someone else in the community, they are not usually transmitting it to a lot of other people, but they can. And the more mobile our society is, unfortunately, the higher the risk for transmission, which is why we are being very cautious with some of what we're seeing. We do want to see economic development really begin to try to grow, but it's very dependent on how much we can continue to make sure we can keep the rate of transmission down. So the more we transmit to each other, the more we are risking the significant health consequences that we've seen so far with the number of lives that we've lost here in St. Louis County as well as across the state. And so that's what we're looking at. This is the entire St. Louis region. So of course we are all very intertwined with each other and impact each other in a lot of different ways. And so from a regional perspective, we will likely be on this plateau for a while. But we do think that because we are on a plateau and not continuing to spike, that we can feel comfortable beginning to ease some of the restrictions and focusing on how we manage and deal with individual behaviors and less about trying to keep as many people as possible at home. I will say though that from a public health perspective, the at-home part is the safest part. So if you can move to the next slide. So I have been getting a lot of questions because there are just millions of documents at this point, it feels like, about guidance from industries and businesses, things that come out from the CDC or OSHA to different types of businesses. There are things that get pushed out from the state. And we certainly read all those. I know that many of you probably do as well. Often we'll take something and be like, oh yeah, that's a great idea, or that was represented in multiple lines of data, so it's probably or multiple lines of information, so it's probably really good guidance that we need to make sure that we communicate or amplify in some way. But one of the things that we try to do at the county level, and one of the reasons that we also add things at the county level, is that we help make sure that it's a dialogue back and forth. So a lot of the things that we do at the county level have come from questions from businesses or industries or things that we're seeing that are specific to St. Louis. So we tend to issue guidance that is much more focused on the context in which we're living and why that's sort of necessary for what we're dealing with here. If you could move forward with one more slide for me. So this is the primary framework for how we're approaching this next phase that we're in. These are the main areas of prevention. And for any of you who have businesses that are familiar and involved with OSHA, these are often used in injury prevention pyramids for the kinds of things that people could be doing. They're just as effective for infection control, and they have been used for other levels of illness prevention as well. So this started from some information nationally that came out from Johns Hopkins and several other places, and we really resonated with it when we talked to some business leaders about how familiar it was for some from the OSHA standards, but also why we need to talk about like what are the most effective things that we can be doing in order to decrease transmission of this disease, to other things that we can still do, but they get continually less effective as they move down this upside down pyramid chart. So often, it always starts with elimination. Can you eliminate the need to be doing something face-to-face, physically removing the potential for an exposure? Sometimes that works. Obviously, it would be the most effective way to do this. It doesn't always work in every situation or scenario or type of business or engagement. Can it be substituted? So this, for example, is just the perfect example of a substitution. I have been and presented to North County Inc. in the past in big giant rooms where we were all together and having conversations at tables and breakouts and lots of other pieces. But this video webinar opportunity is a substitution of that. So you try to have like the essence of the dialogue and the presentation without the need to be physically present. Engineering controls are the next thing. So physical barriers. So this is something that's probably going to be the things that many businesses can look at what they're doing in their immediate environment where there could be a physical barrier between people. In St. Louis County government, we are looking at all of the places in which we have front-facing staff and walk-up counters and other kinds of places where we're interacting with the public and having to put some sort of barrier, a plexiglass piece or something along those lines. We have places where we have open work areas where there's no real delineation between staff members that work together, and that there are all of these additional pieces, some physical barrier between people in each of those spaces is more effective. The next is the administrative controls, and this is where I would put things like cleaning. It's where I would put the 6 feet of distance. If we can just sort of generally stay 6 feet away from each other, that is somewhat more protective, but that's a behavior. There's no barrier that prevents you from doing it. It's a behavior that you begin to exhibit. So you change the way in which you perform work so that you are less likely to transmit illness to each other. And that's what those administrative controls are. Can you change the way people work in the environment in order to decrease transmission? And then it is certainly still effective, but it is the least effective of all those strategies are those opportunities to wear personal protective equipment. For most of your businesses, unless you work in a healthcare setting or a setting that deals directly with COVID positive patients, then any cloth mask or disposable surgical mask or anything along those lines is then recommended as a minimum standard. If you have seen the orders that were signed and put out by the county executive and the health department this morning, you will see that we are saying that all businesses should wear masks have masks for your front-facing employees in particular. I will tell you that everyone here at the health department is wearing masks at all times, and especially when we are passing each other in the hallway or engaging in conversations with each other. And when we have closed down some of our areas of congregation and many of those other things. It is helpful. We have not mandated that every individual in the community wear masks. However, we are definitely encouraging it. And we have in this order made it possible that if a business feels like their staff that if someone comes in and is not wearing a mask and it is your expectation that they do, that you do have the opportunity to require that. Or to potentially deny service. It really is just about how easily this particular virus transmits to so many other people and how many things we still don't know that makes us just really focus on being as protective as possible and having ways in which we can creatively engage in the practices of business and still have that level of protection. And if you could advance another slide for me. So I talked a little bit about some of these, but these are some of the basic rules that are in the order. There's a lot more pieces that are in the order, but from a brief standpoint, these are some of the basic pieces that are included. The order is also up at that stlcorona.com website, so you can see it from there. But those engineering controls, physical barriers, and design elements, we really are in the county putting those in as many places as possible. And we have also done the clear markings and directions for social distancing. We have a few areas for some types of services where there's a line that forms. So we are marking those line areas off with tape or dots on our floor in different cases to make sure that people aren't grouping up or grouping together and that 6 feet of spacing is marked so that they can clearly try to keep away from each other as much as possible. And then we do still recommend limitations on number of customers, employees, and others in your business at any one time. So you will see that a lot of the order focuses on probably a 25% occupancy permit for most types of businesses. There are still some businesses that We have not yet opened. We are taking a cautious approach. I have spoken with the county executive at great length about this, and it is very important to us that we not have to go backwards in this whole crisis. We don't want to have to get to this level of community suppression again. So we are being cautious in order to make sure that we do not, if you remember that second slide that we had up there with the long piece, if you see that our transmission rate is just below 1, it would really take a 10-15% increase in the number of cases that we would have to swamp our healthcare systems and put us back in severe territory relatively quickly. So it's still an ongoing issue that we have to manage and continue to move forward through. So limiting the number of people that you come in contact with on a daily basis is a very important method of reducing transmission risk. Cleaning and sanitizing just can't be said enough. There are lots of information that we have put up on our website, as well as other pieces on the EPA and the CDC. Many have put out additional guidance around that. Cleaning and sanitizing is incredibly important. I would also be very thoughtful about whether or not your business has a customer base that may be high risk, and in that potentially having hours that are catering to high-risk individual customers would be something that we would advise. I would also make sure that you are very proactive in monitoring employees for any signs of illness, and really make sure that any ill employee is not in your facility, is at home, and then potentially gets set up with us or any other community testing site to get through the testing process to find out if they have it and if they are communicable. It's just critically important. These are easily translated in workplace environments in a wide variety of ways. And the same may be for customers as well. I would be very thoughtful about allowing any ill customers or visibly ill customers. And that's where those masks can be helpful for your employees. It can protect them from people in the community and from an illness or symptoms that they may have. Soap and water is the most effective option for personal hand hygiene and cleaning. It is more effective than hand sanitizer, but hand sanitizer and Kleenex and all those other things, they are effective if you do not have access to soap and water. But soap and water is more effective. And so any opportunity for lots of hand washing breaks for customers, for employees in particular, to keep doing that will help keep your employees safe. And then if you can make arrangements, and this is back to that kind of substitution space in that pyramid, contactless payment, pickup, delivery options, the curbside pieces, all of those things that limit physical contact are going to be the most protective. I know there's lots of logistics in how that gets organized, but those will be the most protective things. And I really can't stress this enough, because you guys are also in the epicenter of where we are seeing some of the most significant community spread. And it is across our North County community. And we need to be making sure that any employees, any customers that you have that are coming in your stores, that they have opportunities to engage in commerce, if that's what's open right now, but that it's done with that best sense of protection as possible, because increasing the rates of transmission is just going to increase the disparities that we're seeing. It's just going to increase what we're seeing in terms of how that transmission is affecting some of our most vulnerable populations in a wide variety of ways. And so it's critically important that we do these kinds of protective measures. One more slide for me. So the last piece is, I very much hope not to get back to a point where we have to do this level of suppression in the county again. So what we have been building this whole time is hopefully our opportunity for the health department to be more precise. Our ability to be precise depends a lot on the behavior of our community. So when we see transmission increases or outbreaks or cases in the future, we will try for the lowest levels of suppression and quarantine as possible. So if I can find an individual who's tested and I can make sure that I can get them isolated and quarantined, come in contact with any of their close contact family members, or anybody that they've been with in the previous 48 hours, that I can help make sure that those individual people get isolated and quarantined, get tested if they need it, and go through their quarantine as safely as possible. And that's at an individual level. Sometimes we may find, though, that there is a place, a specific location that multiple people all got the same sickness at. And so if I find out, potentially track back to a business and say, there is this particular business and 10 people that we have now seen as positive cases all had contact with this same business in the last couple of days, we will contact that business and say, we need to talk about your transmission and infection control procedures at your business because it is not suppressed enough, and it is fostering this level of transmission. And if we have to engage with that business on additional closure procedures or sanitization procedures or anything else we can do to lower that risk of transmission, then we will. We are also and that affects an individual business. And again, that's only if I'm tracing back too many individuals and it all leads back to a business. If anybody there is a restaurant owner, you have probably engaged or heard about the health department in this space around hepatitis A or other communicable diseases that we are responsible for on a regular basis. And if it becomes clear, we are tracking occupational data from all of our positive cases. So if it becomes clear as we move forward that there's a sector of industry that just has too much transmission that's constantly happening in that industry, then we will also have to talk about whether or not that industry can safely remain open or can do something else that can decrease the level of transmission from that industry. And so that's why we're being very cautious in how many industries that we're opening up. So we've opened up some additional opportunities for restaurants, for example, because we know restaurants do get a lot of training on safe handling and some other pieces. And so it may be possible to do infection control, but it's risky. So we are hoping that we do not get to a place of completely uncontrolled transmission across the county. And we will be focusing on precision as much as possible as we move forward. That's really the base part of the presentation. On the stlcorona.com website, you will see the new order in all of its very legal details. There's a business guidance document that I took several of these pieces from that is much more of an educational piece around what it is we're encouraging or mandating that people do. And then you will also see some additional guidance that's up there now for specific businesses. And then we are working with some of the business groups around the area that are trying to put some St. Louis specific industry guidance together as well. And then there's a business-covid@stlouisco.com email address that I think Rebecca is going to send out also. If you have a specific piece about your individual business practices, you can email us at that email. So I've taken a bit of time, so I want to leave a few moments for Q&A.
So Spring, I think we're gonna quickly go through others' presentation and do Q&A at the end, if that works for you. Can you hang in there with us a few more minutes?
I can.
Okay, thank you so much for that grace. Okay, so Evan, can you move on to the next slide, please? So Brian Hall with Explore St. Louis had planned on being with us today, and unfortunately—
I'm with you, Rebecca.
Oh, Brian, welcome. Thank you. I'm glad you popped in. So real quick, Brian is the Chief Marketing Officer for Explore St. Louis, and he is going to share with us some key information from an industry perspective. Brian, go ahead, take it away.
Well, good afternoon, everybody. And Rebecca, thank you so much for the invitation to join all the businesses in North County. You've been just a fantastic champion from a Chamber of Commerce and Economic Development perspective over the past several weeks as we've been sort of navigating our way in this new environment to understand how we can safely bring our businesses back. I just caught the tail end of what Spring had shared, and she had mentioned that a number of business leaders in a variety of different industry sectors have been joining forces to sort of translate the directives and advice from public health officials and apply them to the operational realities of your respective businesses. So we're tackling in cooperation and collaboration with public health officials and a number of economic development organizations, including North County Inc., the St. Louis Regional Chamber, the Economic Development Partnership of St. Louis, and about 15 others in the bi-state region. We have assembled groups that are tackling 10 different categories of different industry clusters. The categories are on the screen in front of you right now. They are construction, manufacturing and repair, educational facilities, event venues and attractions, which is near and dear to me from a travel and tourism standpoint, healthcare facilities, hotels, personal services, professional services, restaurants, retailers, and transportation. So our goal is again, in lockstep with public health officials in the city and the county, is to address some of the operational realities that you're each going to be encountering in your respective practices as you implement the city and county orders as they apply to your respective business. So what we have done is we brought together groups of professionals that represent each one of those industries that I just mentioned, and they've been doing an outstanding job of curating some best practices that we look forward to sharing with you in the not too distant future. In fact, we've been working on this for about the past 2.5 to 3 weeks. We've made really good progress. We've got drafts for about 5 or 6 segments that are completed. We're going to be sharing them with Spring. We're sharing them in the city with Dr. Eccles, and we look forward to finalizing some of this content and posting it in the coming days. But one of the centerpieces of the content will be some of the core principles of reducing the spread of the virus, including social distancing of 6 feet at all times, and when not possible, even creating barriers and partitions using plexiglass screening so that you can successfully ensure that virus can't be transmitted from an associate to a patron or vice versa. We've also put in place some very rigorous employee health screening procedures that I think you'll enjoy, because your employees, particularly in those businesses where your employees are interfacing with a lot of customers each day, if they became sick, they have the capacity to infect a lot of people. So we want to make sure that we screen our employees, and we put together a series of protocols that include a questionnaire, taking their temperature, and then a lot of practical advice and training that is going to be so enormously instrumental for employees to help understand how they can be safe. And then next, one of the really big challenges and requirements is wearing a face covering. Been a lot of conversation in reference to PPE. I will tell you that, and Spring probably shared this with you earlier, but the requirement need only be a fabric-based face covering or a surgical grade mask that is simply disposable. You need not, unless you're protecting somebody that's in a vulnerable population, you need not have an N95 mask that is for healthcare professionals. You simply need to invest in some fabric face coverings, which are enormously effective. And interestingly, it's not about protecting you from others, it's about protecting others from you. And the face covering serves to diffuse and localize the molecules of potential virus that you're exhaling, or even when you're speaking, that can emanate from your face. Instead, if you have a face covering, you are localizing that content and reducing the spread very successfully. And then the last big component that's going to run through all of the practical advice that we provide is cleaning, disinfecting, and sanitizing. We talk a lot about both FDA procedures as well as EPA, and give you a lot of practical advice in reference to wiping down frequently touched surfaces like doorknobs, like countertops, and a host of other recommendations that'll help you ensure that you're doing everything that you can to reduce the spread of the virus. Our goal is that all of this content is going to be posted on the St. Louis Regional Chamber website. The website address is on the slide. It is not there yet. It will be there in the coming days, and I will communicate with Rebecca so that she can communicate with all of you as soon as this content has been fully vetted by public health officials like Spring and Dr. Eccles in St. Louis City, and a host of others who are actually working as well with the Pandemic Task Force and getting their advice. Once we have received all of their consultation and it's manifest within these documents, they're going to be posted online. So thanks again, Rebecca, for the opportunity, and I'll turn it back to you.
Brian, thank you very much. I know you are crammed for time, so we really do appreciate you popping in on us there. Also, I'd like to just mention on that St. Louis regional website that Brian had on the last slide, there's a lot of other COVID-19 information and a lot of other resources listed there, as well as on our local chamber websites that businesses might look at in regard to other types of resources from a financial perspective or granting perspective. So please take a look at your local chambers in your area to get that information, or the St. Louis Regional Chamber COVID-19 pages. There's just a ton of information and resources available. Next, it is my privilege to introduce, oh, I'm sorry, one more thing. If everyone could please put your questions in the Q&A button. So if you look at the very bottom of your Zoom window, there should be like a little Q&A area that you can pop in and ask questions on. So if you can actually put your questions there, not in the chat, that way we can try to track them a little bit better and more efficiently. Thank you so much. Now, Jim Ertl is up next, and he is the Executive Director of Human Resources at UMSL, where he leads the 12-person team handling HR functions for the campus. His career has included experience with small local profits offering education and business services. And prior to UMSL, he held a corporate HR role with a global manufacturing company. He is a native of St. Louis and a graduate of UMSL, where else, right, Jim? Right. And then also tag teaming with Jim a little bit is going to be Catherine Prulex. I hope I got that right on your last name, Catherine. She is the human resource consultant with People Solution Centers, and she has extensive experience in benefits design, compensation design, employment law and compliance, performance management, and employee relations. She specializes in helping small businesses refine their human resource processes and procedures. And she has a JD from New York University School of Law and a BA from Truman State. So thank you both for joining us today. And Jim, I'm going to let you take this away.
Okay, thank you, Rebecca. And good afternoon. I appreciate the opportunity to speak to the group today. And tell you a little bit about our story, how we've experienced COVID-19 and the pandemic at UMSL in what is a very complex sort of environment. And so here's just a few examples of, I'm going to give you some general information about how we've done that, but realize that we probably have every variation of a business type that you can imagine. So we have a gym, a recreation center, which was our first unit to be closed down when we were still had people on campus working. And within a week or so of shutting that down, we sort of got the order that we needed to evacuate campus. So we went from having 1 or 2 units that needed to be shut down to we were going to staff for minimums. Minimum service to we really didn't want anybody on campus. And so that's kind of how quickly it happened within a week or so for us. So we have facilities like that. We have event facilities. The Two Hill Performing Arts Center may be one most of you are familiar with. classroom space, study space, laboratory space. The lower right-hand corner is our student center, where we have students who like to congregate and socialize and do all the things that you would expect college students to do. We are primarily a commuter campus, so about 96% of our students live and work in the area. Many of them are customers probably of your businesses. And so we're a little different than the traditional sort of campus where students go away, very different than like a Mizzou, for example. So that's our background. We're a public employer. Some of the rules we follow are a little different because we're bound more by state, for example, than a lot of federal. We're not regulated by OSHA, even though we rely on some of their stuff. So just realize that some of those differences are going to exist in what I'm telling you and what I'm explaining to you. We also have a fairly robust emergency management response structure, which I'm a part of. So I may go back and forth between specific HR matters and just how we're thinking about how do we manage this as a university campus. From an HR standpoint, one of our first issues was paying people who may or may not be able to work. So we had started a process to figure out who could work remotely. You know, we had about a month where we offered paid leave, and then we had to transition from a period of time where people were getting paid administrative leave. Then we had federal legislation that came out in terms of the emergency paid sick leave, emergency family medical leave that applied to us, and that we had to comply with, and which replaced the paid leave we had intended to do. So as of about April 24th, some of our employees reached the point where they may not have had any PTO time available to them, and they went up there on unpaid leave at this point. Some of them are partially working remotely from home if they're able to do that. Some of them are fully able to remote work. And so we're dealing with those variations. And it's kind of leading to these kinds of actions now that we're looking at in terms of on top of not having people able to work on campus is, you know, if you're a for-profit business, you don't have customers coming in. We not only have customers not coming in and refunded students for meal plans and housing, the state withheld part of the budget that we expected to have at the beginning of the year. So we have budget pressures as well that we're responding to that are related. So these are the measures that we've fairly quickly had to come up with. Short-term furloughs and long-term furloughs for us mean a week off of work without pay. In the case of short-term, long-term furloughs are 2 weeks or more, and we've limited that to a 90-day period that we would furlough someone potentially. These are just starting to roll out on our campus, but we've only had the furlough policy was created in response to COVID. So it was something that we didn't have in place that because of COVID-19, we put in place and are now able to use. The rest of them we've had available to us to use. So those apply to all of our staff, which are mainly exempt, non-exempt, at-will positions like most of your employees would be. We also have this unique situation with faculty who are technically on year-long contracts potentially, or multi-year contracts. And this was new for us too, in terms of modifying policies or creating new policies that allow for temporary reductions of their full-time equivalency. So they might work 75% of full-time, for example, or temporary salary reductions for a 3-month period. So those two were new and have just been rolled out in the last month. So higher ed isn't usually known for moving quickly on things, and I would say this is a time when we've really had to move quickly and respond to this issue. So those are kind of the not fun parts of HR that we're kind of dealing with right now. Like HR is not always a fun place to be, but really right now it's kind of a focal point and with a lot of demands. One of the positive things we've tried to do in terms of communication is once everybody left campus, it was important to somehow keep people connected and to deal with the rumor mill that was more than likely gonna spring up. Our grapevine's pretty good, but when everybody's remote, that was a concern. So we do weekly all staff Zoom calls. We use the same webinar format. And we get about 300 people a week who basically go through a Q&A, and we modify any communications that have gone out that week. So that's how we do our communication. This is our repopulation plan for the campus. It's still tentative, so know that this is all potential to change. We're in this identification phase right now where we will start asking supervisors to reach out to their employees and just ask the question whether there are any barriers to them returning to work on campus. If we just uncover that they have health concerns, disability concerns, that's when we would ask supervisors to refer them back to us in HR so we can dig into specifics. We will likely expand our accommodation process. So this similar process we use to accommodate disabilities, we will expand that to include those health risk conditions, diabetes, high blood pressure, those kinds of things that we will likely accommodate as people come, as we ask people to come back to work. And so that's kind of our plan right now with the identification phase. We see childcare being an issue. We see, I have vulnerable family members at home that I don't want to bring something back home to them. Fear that we're just going back too soon. I mean, we're going to be having to deal with all of these, and hopefully we do this in a fairly empathetic and compassionate way, and try to be as flexible as we can be, understanding that this is kind of an unprecedented situation. One of the issues is the richness of unemployment benefits right now. And this came up in one of the questions. It's also one of our concerns. And quite frankly, if we have work for folks to do, the question I think is, can people just refuse to come back? Do I have to keep them? And quite frankly, if you have work for people to do, they're not qualified to draw unemployment. And so, so there is a counter to that if people are just refusing to come back. I mean, we would accommodate them if they wanted to stay on unemployment, I'm sure, but they couldn't be both employed and on unemployment benefits. And then lastly, the way we deliver learning to our customers, our students, is going to be modified in the fall to allow for social distancing. We were probably only going to be able to have about 25% of our student body in a classroom at a time, because we have to spread out desks and we have to spread people apart. And we're working through those scenarios right now in terms of how we accommodate that space. Same with employees. In my office, our workstations are not 6 feet apart. So we'll likely be on like a rotational schedule where we'll have every other cube full on every other day, right? So people will alternate between working from home and working on campus, very likely. Okay, if you want to go to the next slide, I'm going to skip over cleaning disinfection. We're doing that right now. Our custodial staff is hard at work on campus, and they're cleaning classrooms and cleaning labs. They're putting seals on all the doors so people, when they walk up, know that they're walking into a space that has been sanitized. And they will be very visible when we go back to campus, and we will clean to a greater extent and more frequently than we have before. So that's without saying. I just wanted to get to the employee part. So our Our tentative dates right now, before we really had details on what St. Louis County was going to do, was June 1st to get our first group back. And we are still planning on maximizing remote work. These are only essential people doing essential things to prepare the campus to get people and students back. We have healthcare clinics on our campus. Our optometry clinic is likely going to open with clinic level mitigation measures and things like that. So we will ask employees to check temperatures before they come to work. We're determining whether we're going to be checking temperatures at different places on campus, but it's kind of an unwieldy place to make, because not everybody comes through, you know, 1 or 2 doors. Non-clinical employees, we're going to ask, obviously, we're going to follow the St. Louis County orders. I had this on here before they released those, but we were going to already ask people to wear a mask. We expect them to wear masks if they're in public areas outside of their work area. We consider that the same as any other policy, and it would subject people to discipline if they refuse to wear masks, and we'll remove them from the campus if it got to that. If we needed to do that, we're able to remove them from campus for not complying with our workplace measures. Okay, we will ask employees to disinfect their personal work areas. So each unit's going to have some, you know, Lysol wipes or bleach wipes or something to kind of wipe down the common areas. We'll ask people to notify their supervisor if they're feeling ill or somebody in their home is ill, and then to stay home until they're symptom free. We also require travelers. It was level 3 countries before we were all level 3 countries to self-quarantine when they come back, and I expect we'll take the same approach when we repopulate campus once people start traveling again. You can go to the next slide, please. So I wanted to just make sure I touched on a couple of these. Tara Vandevoorty, my colleague, is going to take questions when you get to Q&A because I have to run to another meeting. But we are following CDC, OSHA, St. Louis County Public Health. Those are the bases for all of the things that we're doing. So if somebody comes back to us and says, why are you doing that? We're going to say, we followed CDC's guidance. We followed what the public health authorities in St. Louis County are requiring us to do. Our chief of police is one of the people on our emergency management group, and that's been one of the things that he's been very strict about, and I agree with him on that, is let's follow the advice of these authorities. I would say on leaves of absence, can you require people to use PTO? If you've required that in the past, there's no reason you shouldn't now. If you need to modify or write a policy to do that or start a new precedent, certainly do that. Sick employees, one, I would say make sure employees aren't penalized for staying home for being sick if you can do that. So if you can be flexible in terms of that, don't make the incentive to come to work or the punishment to be, you know, I'm not going to get paid if I stay at work when I'm sick. Clean and disinfect areas, you can read the answer there. We have not done any contact tracing ourselves. So if somebody did test positive, that gets reported to public health authorities, and, you know, we would leave it up to them to do the contact tracing if that was required. If employees refuse, I told you that we can remove folks. We would remove folks from the campus if they refuse to practice our mitigation measures. Somebody asked if they ignore social distancing stuff and just reopened. I would just have you consider what your customer's reaction to this. I think there's going to be a great deal of fear in terms of people, whether they leave their houses at this time or not, and where they're willing to go. Unemployment claims, we've been careful not to give unemployment advice to people, but instead have referred them to the Division of Employment Security and encouraged them to apply for it, and then let the Division of Employment Security decide if they're eligible. Some of these measures we took, furloughs, for example, according to the website, are eligible to get unemployment for, but we still encourage them to go to the Division of Employment Security and apply. The professional cleaning question, again, that's CDC and public health guidelines that are appropriate. There's a ton of industries that have different recommendations. I think the stuff Spring gave us was really, really good. Can I force my staff to come back to work or fire them if they do not? If they're making more unemployment, I answered that earlier. If you have work for them to do, they're not eligible for unemployment, and I'm sure the Division of Employment Security would want to know if you've offered someone the ability to come back. And that's the last of mine. So we're preparing, we're anxious to get back in the fall in whatever capacity, but I think for us, we know that that capacity is going to be a lot different and a lot smaller than it was when we left campus. And that's all I have, Rebecca.
Thank you, Jim. Catherine, do you want to take a couple minutes and add anything, or wait till we come back to Q&A? What's your preference?
I can go ahead and wait till Q&A.
Okay.
Yep.
All right, great, thanks. So now we're going to move on to some legal matters to consider. And it's my privilege to introduce you to Richard P. Dorsey. He's attorney at law, graduate from St. Louis University with both a Juris Doctorate and Masters of Business Administration. And since he has practiced law in St. Louis area, where one of his primary areas of concentration is advising small family-held businesses. He currently serves on the board of directors of North County Incorporated and the Greater North County Chamber of Commerce, as well as on several not-for-profit organizations in the area. I know that we do have some not-for-profits joining us today. So at this time, it's my privilege to let Rick share some of his knowledge with you when it comes to legal concerns. Rick? Rick, are you there? We are not hearing Rick at this point.
Can you hear me now? Rebecca, can you hear me now?
We can hear you, Rick.
Yes, we can hear you.
Go ahead, Rick.
Now. Rebecca.
Yes, we can hear you, Rick. Go ahead.
All right, thank you. Okay, first we'll start off with a disclaimer. The information contained in this presentation is for informational purposes only. It is not intended to create an attorney-client relationship. For specific questions, please consult your attorney. And that leads into my next slide, Evan. Insurance. That disclaimer was given because my malpractice insurance carrier requires me to give that disclaimer anytime I speak to the public in general. You need to check your insurance before you open up. Find out about your coverages and deductibles for both your liability and your workers' compensation insurance. We are currently hearing in the legal field that on the western side of the state, some insurance companies are denying business interruption coverage even though the businesses were shut down due to the COVID outbreak. So it's important before you open up to find out whether or not you're covered. Most workers' compensation policies will cover this type of situation, but again, you need to make sure before you open up. And the reason for that is, even if you are not at fault, you can spend thousands of dollars in attorney's fees proving it. We operate under what's called the American system, where in any lawsuit, each side pays their own attorney's fees. So just because you win doesn't mean you're going to get that money back. Those fees will not be recoverable. When we're looking at litigation type situations, the plaintiff's attorney will most likely be working on a contingent fee. That means they get a percentage of what they recover for their client, while your attorney will most likely be working on an hourly basis. Litigation, even if it's short-lived, can cost thousands of dollars. One of the best examples was raised in one of the questions, the Smithfield Foods case. There, a federal lawsuit was brought on behalf of the employees at a plant in Milan, Missouri, claiming unsafe working conditions. The federal court judge on Tuesday dismissed that case. But if you look at the pleadings, you will find out that the defense of Smithfield Foods consisted of 8 attorneys. Those attorneys were not working for free. So just, even though the case was short-lived, you can be sure that Smithfield Foods attorney fees were somewhere in the nature of $5,000 to $10,000 just to get to that point. It's important that you know what you're risking, because if you don't have proper coverage, you're going to have to pay for it yourself, even if your insurance company defends you on a reservation of rights. Let's go to the next slide. Customers. That's a primary area of your concern, is when you open up to customers. And check the county, state, and CDC guidelines for your business and strictly adhere to them. If you are complying with the guidelines that are in effect, it's going to make you much more resistant to a negligence claim by somebody who claims they got the COVID disease at your place of business. If you're not following them, then you are risking gross negligence claims, or possibly even an intentional tort if you are deliberately ignoring the guidelines. St. Louis County is requiring customers to wear a mask when they enter your business and throughout the stay. Actually, they're saying they strongly recommend it. You should require it. Routinely clean surfaces that are open to the public. Next slide, Evan. Practice social distancing. You can refuse service to anyone if you believe they present a hazard to you or your employees. And as St. Louis County said, they're encouraging customers to wear masks. You have the right to refuse service to anyone so long as you are not discriminating on an illegal basis. And most of you already know those bases: race, religion, gender, national origin, those same things that always apply to your business. So if somebody comes in not wearing a mask and you have a sign in your window that say customers must wear masks to enter, and they come in without it, you can immediately ask them to leave. If they refuse to leave, call law enforcement. Have law enforcement remove them from the building, because then they are trespassers. If a customer claims to have gotten COVID-19 at your business, get all of their identifying information, their name, their address, their phone number, and report it to your insurance company immediately. Most insurance policies are on a claims-made basis. So as soon as you know, they need to know. That's so they can investigate. Before we go on to your employees, a question came in, what about rent? Well, I can tell you that there is a mistaken belief out there that during the COVID outbreak, you do not have to pay your rent. That is incorrect. Rent is still due. If you're having problems making your rent, talk to your landlord about it. Don't force them to go and have a rent and possession lawsuit filed against you. Another mistaken belief is that the courts are closed. They're not closed. I'm filing lawsuits for clients all the time. The fact of the matter is that they will be open to hearings. We're currently hearing on May 18th. That's when they're going to reopen to face-to-face hearings. And rent and possession cases have top priority in civil litigation matters. So talk to your landlord. Don't force your landlord into a situation where they have to sue you. Most of the landlords I'm talking to right now are very understanding. They're letting people pay smaller amounts instead of all at once. They're working other things out. But if you have a written lease and you reach an agreement with your landlord, make sure that that is also in writing. Let's go on to the next slide. Employees, again, check the county, state, and CDC guidelines for your particular business and strictly adhere to them. St. Louis County was very specific. They have 7 points in their guidelines that were issued this morning as to how to deal with employees. Any new policies that you establish, put them in writing. Give them to your employees on the first day and review them prior to opening to the public. St. Louis County is requiring employers to provide employees with masks to wear when they enter your business and throughout their time at work. They do say you can have the employee make their own mask. If you provide the materials, you're better off purchasing masks and giving them to your employees, because then we fall back to negligence. If you've bought the masks and you can swear by them that these are the masks I bought at Walgreens or wherever, then you're much safer in defending any kind of claim against you. Routinely clean work surfaces. Practice social distancing. You heard these earlier in the webinar from St. Louis County. You heard them from Jim Hurdle. It's important that you do that. Next slide, Evan. If an employee shows up for work and appears to be ill, send them home immediately. If they have symptoms associated with COVID-19, have them self-quarantine and don't allow them to return to work without a doctor's letter stating that they are recovered. Congress and the passed and the President signed the Family First Coronavirus Response Act, and it applies to all employers with less than 500 employees through the end of the year. It's very similar to the Family and Medical Leave Act, except that it applies to small employers. There are several slides in this presentation. I'm not going to go through them with you in detail, but I would ask you to read them at your leisure just so you know what to do with regard to the FFCRA. Okay, Evan? If an employee claims to have gotten COVID-19 at work, report it to your workers' compensation insurer immediately and follow their recommendations regarding how to treat other employees, remaining open, etc. If you reopen and an employee refuses to return to work because they are getting unemployment benefits, they become ineligible to continue receiving those benefits. You have a right to contest their claim. Contact the Division of Employment Security to determine the procedure. I just went through another webinar prior to this one, and the people involved in that are saying that a fear to return because of COVID-19 is not sufficient to stay at home. The fact of the matter is a generalized fear is not good enough. Now, let's suppose that they are living with a family member who falls in one of the at-risk categories. They can get a letter from that person's doctor stating that they have to quarantine at home because of the illness for their family member. That is acceptable. They could continue to receive unemployment. You should have a copy of that in your file. With regard to policies and procedures, once you have established policies and procedures, you should have them for your business across the board, and I'm sure our HR people would tell you the same thing, but you need to document the file every time somebody does not comply with the procedures and what actions you took in response. This is how you defend an unemployment claim. The more information you can provide to the division in a hearing justifying your terminating them, it will make it easier for you to prevail. You want to prevail because your unemployment account is taxed if you do not properly document your file. With that, I'm sure there will be questions in the Q&A period for legal, but I wanted to thank Rebecca for putting this on. The fact of the matter is that this is necessary. I've been giving much of the same advice to my clients. And in conclusion, I want to say the decision on when and how to reopen your business is going to be based on the nature of your particular business. But if you act carefully and apply common sense principles, you can resume operating safely. Thank you.
Rick, thank you very much. I appreciate that. Now, Evan, do you want to put up the resource? Oh, I'm sorry. Do you want to go past this? Sorry about that. This is the resource slide. If you want some of the links that we've referenced today is here. We've got lots of questions that are popping up through our through our Q&A and also that were submitted earlier online. So one of the questions that we did hear about was from a local volleyball business, and they're very specific questions for that particular business in regard to capacity questions. And what I would recommend that you do if you have very specific questions to your particular business is please go ahead and submit them to St. Louis County. And several times now we've provided that email address. You're going to email specific questions to business-covid@stllewisco.com. So it's business-covid@stllewisco.com. So, and again, we will send that out when we send to any of the registrants. We'll send that out via email along with a link to the webinar. So let's go ahead and tackle some of these questions real quick. So one of the questions asking about face masks is kind of a lot of questions about face masks. Let's just reiterate one more time, Spring, because it seems like some people are concerned, you know, why very specific ones are not being required in regard to, I think they're called the N95, and why the masks are important and the best place or kind to purchase.
So all kinds of masks are helpful. The only things that we consider to be like, when we talking about personal protective equipment, we are talking about an N95 mask, for example, or some types of surgical masks. Those are the most protective things that are out there. They are predominantly used by healthcare workers or people who are doing direct care for someone you know is a COVID positive patient. Or someone who could be COVID positive patients where you may get and you need that level of respirator. So they are the most effective, and if they were sort of very widely available, I think in a broad array of circumstances, then they're the most protective possible thing. However, all masks and cloth masks and other types of the light surgical masks can also operate as a barrier for respiratory droplets when people are speaking or maybe breathing or light coughing or something along those lines. And so it does help catch some of those respiratory droplets, but it does mean that they have to be either thrown away if they're disposable on a regular basis or washed if they're the cloth masks. I do also use cloth masks myself. It is a particularly helpful because we do know that there can be people who don't experience symptoms, but they could still transmit a virus potentially. And so it's just they're the most broadly and widely available for the general public. And that's why they're recommended. There are lots of different types of masks.
Okay, great, thank you. Now, some of the employees are expressing concern about, you know, techniques or ways, based on so many people wearing masks in our society they didn't before, from a being safe perspective for those that might harm them in regard to crime or robbery or anything like that. Is there any recommendation any of you have as far as training techniques? Any thoughts? Okay, so sorry, I don't know that we can answer that particular question, but thanks for submitting it. The next question is, again, and I think we kind of answered this, but let's just reiterate, should an employer submit workers to a thermometer test? Is this legal to do? And what are the recommended guidelines for such a test?
Rebecca, I would refer them to the St. Louis County guidelines where it says that the employers are to screen their employees daily. So St. Louis County has now said that they give the employers permission to screen daily. That certainly could be the thermometer. It could also be a questionnaire that Spring mentioned earlier.
That's correct.
Okay. And any other thoughts?
Fever is present in about 78 to 80% of the cases. So it's not a perfect screening tool, but it is a good screening tool. So we do recommend it. The screening is required to enter, my building here in the health department and most of the county buildings that we currently have staff in and any members of the public in as well, which is also why it's part of our recommendation.
Okay.
Not so
So we do, thank you. We do have questions and this comes obviously from not-for-profit when it comes to small party, in-home parties for fundraisers, etc. Are organizations liable for encouraging small gatherings under 10 people when it comes to trying to do some small fundraisers?
Rebecca, I would, if it was one of the organizations that I was on the board of, I would recommend that they not do that at this time, simply because the organization cannot guarantee the social distancing necessary. You're bringing strangers into somebody's home. The levels of screening are not going to be the same, and there could be some third-party liability.
Thank you. And are businesses required to provide masks for customers if they don't have them?
No, we did not require that.
Okay, thank you. Was the FFCRA only applicable after its passage date, or was it backdated?
It was not backdated. It was only effective when President Trump signed it into law.
It took effect on April 1st.
Thank you very much.
I believe, yeah.
Okay, perfect. As a gig worker who performs at weddings, do you think that they should add a death/illness clause into contracts? Any thoughts on?
Rebecca?
Yep.
They probably should have that in their contract anyhow, but they should not just have death, illness, it could be accident, it could be any kind of natural disaster. They really ought to have what we in the law call a force majeure clause, which is any kind of natural disaster. I mean, if they're doing a wedding and there's a tornado that wipes out the event, it wipes out the event, and they ought to be protected from that by having that in their contract.
Okay. So same person asking a question about the fact that they are seeing weddings being scheduled as soon as mid-June. What are our thoughts on really being able to host something like a wedding or larger event in mid-June?
So we are basing the place where we are now on the availability of the data that we have. We don't know what the community transmission will look like at that time. We are going to have to cautiously proceed forward so that we can keep an eye on how this is affecting our whole community so that we can identify the ways in which we can continue to help reduce that level of transmission.
Okay, thank you very much. Again, we're back, just lots of mask questions, but there is a concern that food workers in restaurants are not required to wear masks. Apparently they visited several restaurants and none of them have masks on. What are people's thoughts on this?
They are now.
Okay, so let's make that clear to people that, they need to be wearing masks. Is there any, is there any, this is kind of a medical question, I think. It's how does all the isolation possibly inhibit individuals building immunity? If immunity can be developed, I realize the severity of the disease and the need to protect vulnerable persons has to be considered. So it's kind of an immunity question. Spring, are you able to answer that one?
So we do know that COVID-19 does build antibodies in your system. We do not yet know whether those antibodies convey what we would consider immunity. And even if it does convey some immunity, we don't know for how long or how effective it is. I would not at this time recommend anybody consider that there is a protective level of immunity after recovering from COVID until we know for sure. So isolation does not necessarily inhibit any antibody growth that you have. It is your recovery from the illness that generates antibodies, not necessarily the level of isolation you have. Isolation prevents transmission, and it is not necessarily related to the antibodies that you generate.
Thank you very much. So we also have a question about resources and service providers to help small businesses implement some of the safety practices. So one of the things I would say is a couple of things generically about this. I would encourage everyone to please, as you're choosing providers, check with your local chambers of commerce as they have membership directories. NCI has membership directories available. Try to use somebody local. There was actually someone on the webinar open earlier with a place called Advanced Ergonomic Concepts that says she can help. So Advanced Ergonomic Concepts, thank you, Lori, for sticking your name in there so we could give that out. But before you buy products and things like that, check with the Better Business Bureau. Make sure that company is legitimate and that they you know, are someone that you can trust to do business with. That's just a good general business practice. But also I encourage you to see if there's a local company that can help you with any of your needs first before going outside of our North County and our St. Louis County area, because always better to keep those dollars in our community. That's my little plug for local economy. Let me just, I'm trying to navigate so I'm not missing anybody here. And we just give me 1 minute to catch up. Let's see. I'm sorry, just give me another minute. I'm scanning through like 35 messages here, so try not to repeat. It looks like we have covered the biggest ones. What I'd like to do, we have just a couple more minutes left. I'd like to just toss it out there real quick to Catherine. Just, you know, was there anything from a small business perspective that you thought our small businesses should be, or nonprofits should be aware of that we did not cover?
I think we've covered a lot of the things that also apply to the small businesses. It seems like obviously a business of 2 employees is a much different thing to navigate than a business of 500, but there are a lot of our clients are in the under 50 employee space, and we've been kind of helping them navigate the different things. Like, actually, there is one thing we didn't cover. There's but most of our clients have gone out for the Paycheck Protection Program loans, and those have what we can help some of the staff. We can help with some of the staffing concerns with how to navigate that. Although accountants and bankers and lawyers can help a little bit more with how to make sure you're establishing the right parameters for forgiveness, even though they haven't, the terms of forgiveness haven't been actually made entirely clear, but they are helping a lot of places stay afloat and get their employees back on payroll and different things like that. There's the thing about small businesses is you can't necessarily just pay people paid time off, like unlimited paid time off, even if you really want to. So we're advising people to be as flexible as possible, to listen to their employees, to when they do have a strong fear of returning to work, to talk to them and figure out what's going on before completely. I mean, in a lot of cases, I believe Rick said, the fear of returning is not an excuse to not come back. And the other strange issue, which Jim mentioned, is that there are a lot of people that are making more money on unemployment than they were making when they were working at this time, though that will obviously run out at the end of July. So kind of navigating those different concerns and stuff like that, they're just, for small businesses, it takes like a patchwork of a solution.
Thank you very much. Spring, is there anything that you feel like we haven't covered yet that you'd like to just reiterate?
So it really is just so important that we are all focused on these behaviors to prevent transmission. This is really critical behaviors that we're going to have to all engage in, I think, for a while as we continue to move forward. Hopefully, we will find opportunities to continue to increase business opportunities and other ways in which we can engage in society. But this level of protection of each other as people should be employed as long as possible.
Thank you very much. Rick, from a legal perspective, was there anything that we haven't covered that you feel like need to be answered?
Yes, Rebecca, just one point. And talking to all the business owners, consult with your attorney before you reopen. You may spend a couple of $100 for the lawyer to review your plans, your policies, et cetera. But that's a few $100s versus thousands if you do it wrong.
Thank you very much. And actually, we've had like 3 more questions just pop in here that I want to get to if we can. One, I think that hopefully Tara or Catherine, you can answer. Do you need a doctor's note from a staff person who has an underlying condition for not returning to work? Or can they just kind of tell you, oh, I have concerns because I'm a diabetic, and then that's okay?
Go ahead.
No, I was actually going to say, hey, Catherine, what do you think?
Okay. I would say if you require it for one employee, require it for everybody. So you have to, like, the best thing to do is have a policy and stick to it. Some businesses are small enough that you know your employees well enough that you can trust, like, oh, I know you have diabetes. But at the same time, if you have enough employees, there are other businesses out there that don't necessarily trust all of their employees to that level. The best thing to do would be to have documentation from a best practice standpoint. But if you're not giving them any type of leave under the FFCRA, or if they're not, if you're not paying them, it's not necessarily necessary to have documentation.
Okay, great. And then, so Spring, you're probably getting this question a lot, but any tips on finding thermometers at this point?
So we now have a whole crew of people that are trying to source like some of the equipment we're trying to provide and out to members. We are trying to get additional orders in as well. We have had some. We focused on some of the essential businesses that we had open from our original order. Trying to send some things out from some additional places where people could be protected in that. We're still trying to do that and make additional ones available, like where we can. I will tell you that it is something we put a significant amount of effort and resources into, and are not always satisfied with our ability to obtain those supplies. So we keep trying, and we get some in, and we try to turn them around to places that we feel like they can be effective in protecting some of our most vulnerable, especially employees that are out there still trying to service this full time. And that's been a core concern for us. And so almost everything that I have gotten in, I've turned around and given out. So I'll continue to do that for as long as I can.
Great, thank you. So if your employees are returning, can they be asked to do things outside the scope of their job, i.e. work outside on landscaping, painting, things like that? So if it wasn't in their original job description and you're asking them to return to work, but you don't have the customers like you would, but you have other work for them to do, are you allowed to ask them to do those tasks?
Well, we have at UMSL, we've actually done that. And so we have a construction crew that would not be working. The construction projects are on hold. And so we are having them help out with the grounds crew since they are still active. It's a similar level job, if you will, but it keeps them working when otherwise they wouldn't be paid. So we have done that.
Thank you. Spring, I think this is maybe for you. If they have like a sports venue and they know they know the sports are on hold, but do you think in general they could, after checking with the email address that we've given out, but do you think they could open to serve food and drinks, or not at all because they were originally a sports venue?
They would have to submit that.
Okay, all right. So please submit direct questions about your business. Please submit to the email address that we've kind of given out. So again, I want to thank everybody very, very much for participating. I want to thank our panelists. You guys have been terrific. Just to reiterate, we are going to, anybody that registered, we are going to send out a link to this webinar. We will send out a handout that Spring has kindly put together for us. And also we'll send out that email address for St. Louis County for direct business questions that are very, very specific. And at this time, I just, again, want to thank UMSL for hosting the Zoom for us and helping us through all the technicalities. And I know throughout the next week, you're all going to be taking deeper dives into reopening. And I just encourage you to please be sure that you're checking the St. Louis County Public Health websites, OSHA, CDC, to try to look at what you need to do. Thank you very much and have a great and safe weekend.
Thank you.